Today, today I am going to explain about the pneumonia. So first of all, I will come from top to bottom with a very clear explanation. First, what is the definition of pneumonia? Pneumonia is an inflammation of the lung parenchyma. What comes in the lungs? There are two lungs in our human body. What comes left and right? Lung. What comes in the lungs? In lungs, what are being inflamed? In the lungs, the alveoli and bronchioles are being inflamed. The alveoli and bronchioles are being inflamed. So those alveoli and bronchioles are called as lung parenchyma. So lung parenchyma includes bronchioles as well as alveoli. So what happens in the pneumonia? There is inflammation of lung parenchyma. What happens actually? Who causes this inflammation? This is the definition of the disease. Now the inflammation is caused by body. It is a natural mechanism of body. How inflammation occurs? Because there is an entry. That is the definition. So now there is that is definition. Now we will go to the cause. There is a bacterial cause. Either bacteria may enter in our body that will reside in the lungs, or either bacteria may come, or either virus may come, or fungi may come, or we can say there may be any other cause. So here cause come bacteria. In bacteria, you will remember the most important bacteria you can write, that is Streptococcus pneumonia, and second is Staphylococcus aureus. These are the most two important bacteria. Then viruses are also responsible. And there are some fungi also responsible who cause pneumonia. And in viruses you can remember adenovirus is there, lot of viruses are there. Then you can remember any other causes are also there, that is suppose mycoplasma is there, or we can say some cause like aspiration of the fluid or aspiration of any substance into the respiratory tract will also cause aspiration. So these are the many causes of the lung inflammation. So these bacteria, viruses, fungi enters into our body through blood. They reach to the lungs. In the lungs, what they affect the alveoli. When they affect the alveoli, body has a natural mechanism that what happens that body tries to attack those fungi, those virus or those bacteria which enter into the lungs. During this fight, they want to destroy them, but there are also alveoli involved in that. So alveoli get affected. So alveoli are being also destroyed. Those alveoli. So there is production of fluid. There is production of exudate. So what happens? These viruses cause, but there is production of mucus. So whenever production of mucus, or we can say exudate, the exudate is rich in proteins. So there is an production of exudate, there is a mucus production, and there will be what happens when macrophages will also enter into the lungs. Those macrophages will also destroy this alveoli. So what happens? There is a destruction of the. There will be a dead tissue. When there is destruction, there will be a dead tissue of alveoli. There will be macrophages. There will be exudate. This all comprises of consolidation. That is called as consolidation. So consolidation is what? Consolidation is an substance. Consolidation is an hot substance that gets formed within the lungs because of the combination of bacteria, alveoli, exudates, mucus production, and as well as the virus, the bacteria which is there. So this consolidation occurs in the lungs. When there is this mucus production and there is exudate formation, what will happen? There will be that was the cause. There will be the occurrence of the pathophysiology will come in this. There will be the signs and symptoms. What will happen? So what will happen? I will explain signs and symptoms very clearly. This is the lung. This is the lung. This is the blood supply. This is the blood supply. This is lung. This is blood supply. So the lungs and blood supply at the lungs, there will be a exchange of gases. That is oxygen as well as carbon dioxide. The oxygen and carbon dioxide exchange will not happen properly. Why? Because there is an accumulation of mucus, there is an accumulation of exudate, so the lungs will not expand as much they should expand. So there will be no gaseous exchange. When there is no gaseous exchange, what will happen? I will tell the sign and symptom. First there will be cough. First sign system will be cough. The cough may have mucus or may not have. At the later stage, we will call it as It will have there will be cough, and this cough will be having mucus, with mucus. At the later stage, the cough will be also having the mucus. Then later, what will happen? Cough, because cough is a natural mechanism to remove the mucus from the lungs, to remove the mucus from the lower respiratory tract. Then what will happen? After cough, what will be the next thing? Cough is definitely there, though gaseous exchange is not occurring so much in the body. So the partial pressure of oxygen will be also decreased. The partial pressure of O2 within the blood will also be decreased because oxygen is not going to all the tissues, is not maintained properly in the body. So then what will happen? The partial pressure of oxygen in the blood will be also decreased, and also what will happen, that there will be hypoxia. The body will not get the oxygen. When there is hypoxia in the body, definitely the tissues in the body, the far tissues, the far to suppose fingers, those will not get the oxygen properly. There will be cyanosis. The death of the tissues will occur also. So hypoxia will be also there. Cyanosis will be also there. Then after hypoxia, after cyanosis, what will be the next thing? After partial pressure oxygen, hypoxia, cyanosis, there will be fever because bacteria enter is there, microorganism enter, so there will be fever also. There will be fever also. We will write here. Fever will be also, hyperthermia will be in the body, and also WBC count will also increase in the body. The WBC count, because there is inflammation, WBC count will also increase. And now we will go to the diagnostic measure. So we are saying this is the explanation, sign and symptom. Now we will go to the diagnose. I am explaining this in the very short. Now diagnosis, how we can diagnose. So partial pressure of oxygen we will diagnose by pulse oximetry. Pulse oximetry. So pulse oximetry. What we do in the pulse oximetry? And oxygen probe will be connected, and in the mid finger, in the finger, then what? Or thumb, then what will happen? That it will give us the partial pressure of the oxygen within the blood. So the normal should be, 92, above 92%, but here it will be below 92. Okay, so this is the balance of partial pressure of oxygen. This will give us about the hypoxia, sinus also. We will also conclude by this. Then fever will be also, we will go, the body temperature will be also increased, WBC count will be also increased, so we will do CBC also. So CBC also we will do. This is the diagnosis CBC. Then there will be cough production. So the confirmed diagnosis will be sputum culture. Sputum culture. So we will culture the sputum coming through, coming by means of cough, that sputum will be collected, and that will be and the sputum culture will be done. The bacteria or the microorganism which is present in the sputum, that will be easily seen. That is called as the sputum culture. So sputum culture is a confirmed diagnosis. And also we can do X-ray. In X-ray also we will see the patches in the body. That's why there are different types of in X-ray, but there will be different. It will show us the type of pneumonia also. Whether the pneumonia is in here I will write whether the pneumonia is an lobar pneumonia. Lobar, that means a lobe is affected. Whether the pneumonia is an lobular, that means lobular means small lobar means small lobe will be affected. Lobular will be the small lobes, small lobule will be affected in the lungs, or it may be bronchopneumonia. In bronchopneumonia, what will it will be lobar? No, first it will be lobar, or it will be interstitial. Interstitial. Lobar means a lobe will be affected, one lobe of the lung will be affected. Interstitial means the space between the alveoli, that will be affected, that is interstitial pneumonia. Then the third one is bronchopneumonia. In bronchopneumonia, what will happen? That different regions there will be patches of affection by means of bacteria. The bacteria will affect different patches of the lungs. That is called a bronchopneumonia. Bronchopneumonia. So bronchopneumonia, lobar interstitial, that we can find by means of X-ray. In X-ray we can easily find that, and we can do CT scan. CT scan also we can do. So sputum culture, pulse oximetry, X-ray, CT scan, CBC, history collection. Mostly we know this. I am taking only the main things. We can go for the history collection. Also we can find some physical examination. There will be abnormal in physical examination. There will be abnormal lung sounds, like there will be chest wall retractions. Chest wall retractions will be there. The wheezing sound will be there, and there are abnormal, all the abnormal sounds which we are finding which we find in the respiratory. The abnormal sounds will be also found in this case. So chest wall retractions will be also found. Chest wall retractions chest wall retractions and other abnormal sounds that will be found in the pneumonia. So this was all about the diagnosis and management. Management, what we do? In management, we will do the antibiotics we will give because bacteria, if bacteria is the cause, suppose amoxicillin we will give. Then we will give metronidazole, that is also antibiotic we can provide. Then for fever, we will give antipyretic for fever, suppose paracetamol we will give or any other drug. Then there will be what? Fever will be there. So oxygen, there will be hypoxia in the body, so we will provide the oxygen. That is the management for the patient. Then after the management, and one more thing is, the main thing in the management is we will give bronchodilators. Bronchodilators, suppose salbutamol we will provide. That salbutamol will also have effect. That will also help us to fluidify, to remove this, because if the mucus is solidified, it will help to remove this mucus from the respiratory tract. So as the bronchodilators will be given, suppose aspirin, that will be also provided in the management. So that comes in the management. Okay. What will come in the management? Bronchodilators will come in the management. Then there will come antipyretics. Antipyretics will come. We will give antipyretics against hyperthermia. Then we will give antibiotics. Suppose in antibiotics we will provide suppose amoxicillin. Then there will be nurse's responsibility. The last one is nurse's responsibility. In nurse's responsibility, what we should do? First, the position should be maintained either lateral recumbent, first choice lateral recumbent, or we can go to the, if there is no, we can go to the semi-forward position also. It will help us for the respiration will be easy in the patient. First thing. Second thing, nurse's responsibility is there should be a proper rest. The rest should be maintained. So the second thing is proper rest. Bed rest is important here. So bed rest is there important. That is the nurse's responsibility. And what we told, proper medication should be given proper time, and also bronchodilators should be given on the proper time. Not only this, suctioning, if there is a need of suctioning should be done on the proper time. Not only this, we should do all the pulse oximetry. We should measure vital signs also. In vital signs, what will happen? In vital signs, what we will see in signs and symptoms also we can find it. In vital signs, what will be there? There will be tachycardia and tachypnea. So respiratory rate will increase because body needs more and more oxygen, as well as heart rate will also increase. So that body has a demand of oxygen, heart rate will also increase. That is called tachycardia. So tachycardia also will be there and tachypnea will be also there. Tachycardia and tachypnea. So tachycardia and tachypnea should be assessed by monitoring the vital signs. So this was all about the nurse's responsibility. So bed rest, medication on the proper time, then assessing the vital signs of the patient, providing oxygen by means of mask. If there is need of oxygen, if the patient is not having the proper partial pressure of oxygen in the blood, that means we should provide the oxygen to the patient. And this is in the very short, there are a lot of things in the pneumonia, but I have taken the pneumonia in a very clear and simple explanation. Thank you so much.